A. Airway assessment. Check your patient's airway for any swelling or any obstruction, either fluid or solid. If able, suction this away. You may need to perform an airway manoeuvre such as a head tilt, chin lift, or a jaw thrust. If you need to insert an oral airway, remember to measure it first before inserting. B. Breathing assessment. Use the look, listen, feel approach to assess your patient's breathing. Look at your patient's chest. Is it rising and falling? Count their respiratory rate if you're able to do so. Listen to your patient's breathing. Does it sound noisy? Can you hear a wheeze or stridor? You may want to check if your patient has any respiratory history. Place your hands on your patient's chest and feel their respiratory rate and respiratory effort. Is it equal? Can you feel chest expansion? You may need to administer some treatment, such as an inhaler via a spacer. You may need to administer oxygen. You can do this via a non-rebreathe mask. Attach this to 15 litres of oxygen via your oxygen tank or oxygen port. Remember to inflate the bag by covering the valve. You may need to supplement your patient's breath. Do this if their respiratory rate is less than 8. Attach the bag valve mask to 15 litres of oxygen, and using a C grip, make sure the mask is covering their airway. Deliver the breaths by squeezing the bag. C. Circulation assessment. Look at your patient. Are they hot? Do they appear sweaty? Has their pallor changed? Check your patient's capillary refill time, both centrally and peripherally. Check if your patient has any chest pain.
Do you have any cardiac history?
If so, where is it? Is it radiating? Is it staying in the middle of their chest or going into their neck or down their arm? Feel your patient's pulse, both peripherally and centrally if you feel comfortable to do so. Count the rate and think about the character. If you have one, attach a portable heart rate monitor at this moment. You may need to administer some treatment, such as GTN spray. Or aspirin if you have it available. D. Disability assessment. You want to assess how alert your patient is. Use the AVPU score. Are they talking to you? Are they alert? If not, are they responding to your voice?
John, can you open your eyes for me? John, try and open your eyes now.
If they are not responding to your voice, do they respond to pain?
John, try and open your eyes for me. John, time to open your eyes now.
If they are not responding to voice or pain, they may be unresponsive. You may wish to check your patient's pupils. Are they equal? And are they reacting to light? You may wish to check your patient's blood glucose level. Remember to check if they have a history of diabetes or if they are fasting for today's procedure. You may need to administer some treatment, such as glucagon. You may need to administer treatment such as buccal midazolam. E. Exposure and escalation. You may need to check if your patient has any visible rashes or wounds. If you have not already done so, you may need to escalate for help.